Hello! In today's video, we'll go over 10 common warning signs of pancreatic cancer that should never be ignored. 1. Dark urine. One of the first warning signs is dark urine. Your pancreas is closely connected to your liver and gallbladder, so if there's an issue, it can affect the way your body processes bile and other enzymes. If the pancreas isn't functioning properly, a buildup of bilirubin, a yellow pigment, can occur. This causes the urine to appear dark or tea-colored, and doctors call this coluria. Other things, like dehydration or certain medications, can also cause dark urine. 2. Oily or floating stool. Another sign to look out for is oily stool that floats. The pancreas produces enzymes that help break down fats in food, so if it's not working well, you may notice changes in your stool. Specifically, it may appear greasy or float on the surface of the water. This is known as steatorrhea, and it happens because of undigested fats. The stool may also be pale and have a strong odor. 3. Jaundice. Jaundice, which causes a yellowing of the skin and the whites of the eyes, is another common sign of pancreatic issues. This yellowing occurs when there's too much bilirubin in the blood, and it's one of the first visible signs of pancreatic cancer. 4. Itchy skin. When bilirubin builds up in the blood, it can lead to itchy skin, a condition doctors call pruritus. This itching might be mild at first, but it can become more intense and even disrupt your sleep or daily activities. 5. Blood clots. Pancreatic cancer can sometimes increase the likelihood of blood clots forming. This is due to certain substances that cancer cells release, which make the blood more likely to clot. Blood clots may develop in the legs, known as deep vein thrombosis, or the lungs, pulmonary embolism. Symptoms include pain, swelling, and redness in the area, as well as chest pain or shortness of breath if the clots affect the lungs. 6. Swollen gallbladder. Pancreatic cancer can also lead to a swollen gallbladder. When bile ducts become blocked due to cancer, bile builds up in the gallbladder, causing it to swell and potentially become tender. This may cause pain in the upper right abdomen and in some cases nausea or vomiting. 7. Sudden and unintentional weight loss. Weight loss is often a warning sign that something's off. When the pancreas isn't working properly, it can lead to nutrient malabsorption and faster calorie burning. For those with pancreatic cancer, this weight loss can happen quickly, typically more than 5% of body weight over 6 months to a year. 8. Loss of appetite. Loss of appetite is also a common symptom. Pancreatic cancer can put pressure on nearby organs and disrupt your hunger signals. You might feel full even after eating only a small amount, which can lead to further weight loss. 9. Nausea and vomiting. Nausea and vomiting can happen when pancreatic cancer spreads and begins pressing on other digestive organs. Sometimes these symptoms can also be side effects of treatments like chemotherapy. If you're experiencing nausea or vomiting that doesn't improve, especially if it interferes with eating, check in with your doctor. 10. Abdominal and back pain. Lastly, abdominal and back pain may occur. Pancreatic cancer can put pressure on nerves, causing pain in the upper abdomen that often radiates to the back. The pain might be sharp or a dull ache and is sometimes more noticeable after eating. Persistent pain in this area should be discussed with a healthcare provider, especially if it's not relieved by over-the-counter options. Thank you for watching, and if you found this information useful, please share it. Staying informed can truly make a difference for both you and your loved ones.